reached 1K participants.
Thank
It's
you, madam.
the first time we have gathered this much of group. It's a very
Thank you, madam.
wonderful initiation of the TNAI Andhra Pradesh branch. So
Thank you, madam.
I think it's the time to start the program now.
Yes, please, ma'am.
Okay. So I'm very much delighted to see all 1K participants in this program. So all of you, namaste and very warm good morning to one and all. Today, as you know, we are all gathered here for a special and a meaningful initiative of Government of India, and as well as leading by the Trained Nurses Association of Andhra Pradesh State Branch. So it's as a frontline warriors of health, nurses have always gone beyond hospital walls to serve the community. That is the reason we are now in this platform to propagate this mental health initiative by the Government of Andhra Pradesh, Government of India, and Trained Nurses of Association of Andhra Pradesh. So in the same spirit, TNAI taken a beautiful step today to reach out directly to the people and make them aware of the service that can bring mental health support right into their homes and as well as in their own language, and it's a completely free of cost for everyone. So that services is a Tele MANAS, Indian National Tele Mental Health Program. So launched on 10th October 2022. Tele MANAS today runs 24/7 through the toll-free helpline 14416 and more than 50 centers across the country, including our own dedicated Tele MANAS cell in Andhra Pradesh also. So to empower every citizen, every family, and every community in Andhra Pradesh to confidently use this Tele MANAS whenever they are there, they are in a stressful situations, or whenever they are in the depressive states. So we need to have someone to listen. So that is the purpose this app and this initiative has taken up, and we want every person is involved in this. And finally, so as a healthcare professionals, we need to propagate this app around the state of Andhra Pradesh to meet the mental health needs of every citizen of Andhra Pradesh and as well as India. So mental health support is just one call away. That is whenever the person needed, the person is depressed and they are in struggling with the mental health issues, they can dial 14416. That is the ultimate number of the Tele MANAS to help our community, those who are suffering with the mental health issues. So on this event, I would like to invite all the participants today, participant as well as our distinguished speakers and esteemed experts of this Tele MANAS. Today we have Dr. C. Naveen Kumar, Professor and Head of the Community at Psychiatry Unit, NIMHANS, Bangalore. He's going to give the keynote speech, and as well as we have Dr. Radhakrishna G, PhD, and Additional Professor of Nursing, NIMHANS, President of ISPN. So we have another keynote speaker also with us today. And we have important presenter, Ms. Sampada, and nursing tutor, the National Apex Coordinating Center, Tele MANAS, so NIMHANS at Bangalore. And other than that, we have any doubts, so there are experts are there to answer our questions, our issues. So we have experts, Dr. G. Balamurugan, and Assistant Professor of Nursing, the National Apex Coordinating Center, Tele MANAS, Bangalore, NIMHANS, and Mr. V. Tamila Pulavendran, nursing tutor, the National Apex Coordinating Center, Tele MANAS, NIMHANS. These two experts are going to, answer the questions raised by the participants at the end of our session. So on this special event, so I would like, and I am very delighted to invite Dr. C. Naveen Kumar, sir, Professor, Head of the Community Psychiatry Unit, NIMHANS, Bangalore. Please, sir, so you go ahead. Over to you, sir.
Ma'am, Dr. Naveen sir is in another meeting. So now we will ask
Can I invite Dr. Radhakrishnan,
yes,
sir,
yes, ma'am. Yes, ma'am.
NIMHANS. So please,
yes,
sir.
Good morning, everybody.
Good morning, sir.
Of course. Good morning to the President, Professor Usha, Registrar
Good morning, sir.
K. Susila, Madam, and we have our secretary KV Sridevi Madam and moderator again Madam Susila Vatli. Happy to have you all, and happy to see that more than 1,000 members are there to know about Tele MANAS program. Of course, all of us know that in mental health care, the clients don't come to you for various reasons. One, it could be the stigma, going to an hospital for mental health care, or they do not know that they need treatment. Given that situation and given the scenario what we have, around 10% of the population who suffers in India, which is a huge number considering our population of 140 crore, 10% invariably needs some kind of mental health care. Number one. Number two, we do not have adequate mental health professionals, be it psychiatrists, psychiatric nurses, social workers, or psychologists. We have just countable numbers in every state. That makes it very difficult, and thereby the treatment gap is huge, varying somewhere from 30% to 90% of the treatment gap. You understand what is treatment gap? Person who do not seek treatment. So treatment gap is one. Another huge problem what we are facing in mental health is dropout. They take medicine, they go for consultation, they take medicine for about 15 days, 1 month or 3 months. Subsequently, they feel that they are normal, they stop medicine. So that adds up to the problem again. In fact, we had a client 3 days back, they visited NIMHANS, and she was on treatment for some time, and she felt normal, and she discussed with her husband. Husband is an educated husband, and they decided to stop the medicine. In fact, husband tried to say that let us take this medicine for another 6 months, as doctor said, but she felt that she is normal. Why should she continue the medicine? After that altercation, husband also accepted, then subsequently they stopped medicine. So given this all scenario and the community health, whenever you go to a PHC, you will find it at least 30% of the health seekers at least have one or other mental health symptoms. So when we span out and see all this, somewhere we need to help the people, though they don't come to hospital. Somewhere we need to see that they need to be helped. So what is the alternative? So COVID time, prior COVID, NIMHANS started telephonic approach, telephonic consultation to the clients. That was a bit successful, and the simple telephonic call for follow-up, simple telephonic instructions was useful. Then came the COVID. We understood that face-to-face interaction or telephonic interaction also effectively helps clients and the family members. And that was proven. In fact, you can see in PubMed, Asian Journal of Psychiatry, Reaching the Unreached was a huge paper. Even today, it's a very popular PubMed article. So thereby, the government of India, upon the proposal, was ready for a pan-India telephonic program. That came the Tele MANAS. And in fact, it was a huge announcement. Of course, Sampada would tell you the history and how this evolved as a national level program, how this is going to be an alternative to DMHP program. Of course, we all know DMHP program is fairly successful in India, but Tele MANAS is the digital arm of mental health program. Of course, Pulavendran may be able to tell us how he is connecting with DMHP. So by this, what we are trying to achieve is trying to reduce the treatment gap, number one. And number two, how nurses, we can effectively use Tele MANAS as a tool for our treatment of our clients. One, you may directly provide care. Number two, you may seek Tele MANAS help for providing help for your own client. So Tele MANAS is a huge success. It's almost 3 years of project now. the government is taking an external audit through WHO and thereby want to fill the gaps, whatever there in the program, and then seal the program as a national level mental health program, digital mental health program. So, of course, we have experts with us. Dr. Balamurugan is the assistant professor working full-time in Tele MANAS, would be able to reach you all in case of any doubt. And I appreciate Dr. Balamurugan, Tamil Pulavendran and Sampatha for making themselves available for all the state TNAI program. And once again, I congratulate the AP team, Andhra Pradesh Nursing Council team, led by Madam Usha and Professor Susila. Thank you all. I hope this would be an enlightening session for all the students, nurses, and administrators in the field of community mental health services and nursing. Thank you. Thanks for inviting me. Good day.
Thank you so much, sir, for your insightful and elaborative explanation regarding the Tele MANAS. So we hope this program will be having very great success in the Andhra Pradesh and the participant will get gain knowledge and regarding the Tele MANAS, sir. Thank you so much. And next I invite Mrs. Sampada, nursing tutor, the National Apex Coordinating Center, Tele MANAS, and enhance. Please, madam, we go ahead. Thank you so much, ma'am.
So welcome you all for today's webinar, Tele MANAS. So Tele MANAS, it's a national mental health program. So National Tele Mental Health Program in India, which we call with the name of Tele MANAS. So Tele MANAS full form is Tele Mental Health Assistance and Networking Across the State, Tele MANAS. So it is a digital arm of District Mental Health Program, as Sir told right now. And today in this webinar, we will be discussing on these headlines. The mental health burden. Second one is COVID-19 pandemic and mental health. And overview of Tele MANAS, aims and objectives of Tele MANAS, and Tele MANAS functionality and updates. So mental health services in our country looks like this. Like it is a less prioritized in our India, and the people are unable to reach the mental health services. So not able to reach everyone what kind of facilities we have. And the impact of COVID has realized that how much the mental health is necessity to our day-to-day lifestyle. So during COVID-19, we have all seen like people were suffering with the mental issues more than the physical. And there are a lot of papers published from WHO in 2022. And during COVID-19, the 35% of people were suffering with anxiety and depression. So these are the common symptoms and disorders we have come across with. And along with that, we have even seen a few more diseases or the cases. The people were suffering with the substance users and stress and adjustment disorder. So these are the common 4 disorders we have come across during our COVID-19 pandemic. And during that time, we have launched a national psychosocial helpline number, and that was the only one mental health care access we were having. And that was also access around our entire country and union territories. And we have reached almost serving 6 lakh individuals with that psychosocial helpline. And that brought us an idea like how mental health services can be dealt with the telementoring programs like Tele MANAS. So then inception of telemental health care services we have started. That is what National Telemental Health Program. And in 2022-2023, first time the mental health has given attention in union budget by Nirmala Sitharaman ma'am to tackle increasing mental health issues in 2022. And on 10th of October 2022, we have launched officially a national telemental health program, that is Tele MANAS. So Tele MANAS means, once again, I'll repeat, telemental health assistance and networking across our states. And it is a Government of India initiative, digital arm of every district mental health program, which we have right now access across our country. So this is our operational guideline for Telemanas, which is released on 8th of December 2022. And our aim of Telemanas is to reach each individual with a helpline of 14416. 14416 is a toll-free number which is accessible across our country 24/7. So you all can see 14416 is our Telemanas helpline number, which is accessible across our country 24/7. This is our aim of Telemanas program. And objectives of Telemanas: delivering accessible and timely mental health care and continuing of services in the community level, facilitating a timely referral for the mental health care, and enhance mental health care capacity and networking across our country. So our principle for a telemental health stands on three broad content. The first one is the accessibility, second one is affordability, and third one is a convenience. Accessibility means it's available across our country. Anybody, anytime can call on this number. Affordability, it's a free of cost. There is no any charge for it. And convenience, 20 plus languages we have of this Telemanas service. So any language people can call on this number and get help of it. And the Telemanas is helping in bridging the gap. So previously we all can see, like before a pandemic, how people were suffering with the distress and illnesses, but they can't able to reach the particular nearest health center or a healthcare services. So now Telemanas is bridging that gap, and it is giving a proper accessible services and early referral. So that is how the Telemanas is helping the people in individual to get mental health services across a country. And Telemanas functionality. So we have the Telemanas is a government of India initiative program, and we have three subcommittees under that. First one is NIMHANS, second one is IIITB, and third one is NHSRC. And under NIMHANS, we have a 5 regional coordinating center, North, East, West, and Northeast. And 23 mentoring institutions we have right now in functioning, and 53 state and union territory Telemanas cells we have across our India. So the first one, subcommittee NIMHANS, which will provide a designing innovative digital-driven training modules for entire country and collaborating with the regional coordinating centers, MI, mentoring institutions, and monitoring all the state cells. And it helps in content development and delivery. It helps in collaborating and monitoring on day-to-day basis, and it provides a standard operational procedures. It takes a part in ethical and legal issues, and it provides even and develops IEC materials for Telemanas program, and it helps, it works for a research related things. And second one, IT architecture by IIITB. So it provides us in designing and architecturing IVRS platform, and it provides even a technical support for entire Telemanas program, and monitoring and developing for ABDM. And NHSRC will be helping us in resource mapping of each state and union territories, and it helps in advising policies related to health system and organization or integration. And it integrates Ayush health system with the Telemanas health program. And you can see on the screen, like we have right now 53 cells functioning all our country. And this is how, like, we can start with the mechanism. So our Telemanas, how it works once you call the state cell workforce, how it will be that each Telemanas cells will be working in this criteria. So tier 1A will be having TMC counselor, means Telemanas cell counselors. Tier 1B will be Telemanas counselors, mental health professionals. And tier 2 will be in-person services. I will just explain with the pictogram. So once you dial on 14416, so you will be connected to IVRS system. So then the call will be connected to counselor. So once, for example, if you have any distress or anxiety calls, the counselor will handle your entire call, and further details also they will get it. But if in case the person or the caller is suffering with a major mental health issues, then your call will be escalated by counselors to mental health professionals or the specialist. So mental health specialists include clinical psychologists, psychiatrists, social workers, psychiatric nurse, and the clinical psychiatrist. So this is how works in a tier 1. So tier 2 will be having a in-person services. When even a mental health professionals feels the caller need a higher level of a care or a in-person services, then MHPs will refer in nearby telemanas cells or nearby district mental health services or a mental health hospitals. And here is an data updated right now. In Telemanas, launched on October 2022 on 10th, and 1 lakh calls reached on April 2023. And 5th of July, we have reached a 23.2 lakh calls. And right now on December 1, 2025, we have a data of 29 plus. We are about to reach a 30 lakh of calls by now. And beneficiaries of Telemanas. So who can call to Telemanas? That is the point for everyone. So here is a clarity. Any individuals with the mental health issues can call us 14416, and any individuals who wants to help a person with the mental health issues can also call on this number. And behalf of any person, for example, behalf of their friends, the person can call and ask a help from this Telemanas toll-free number. And Asha Karyakartas, in behalf of like screening in the community level, if they face any crisis. So if they are facing a crisis in screening, and once after a screening, the identifying of case also very difficult for Ashas, then they can lift on this call and get a help of 14416. And community volunteers like community mental health officers or a community level, any workers can call on this number, and teachers behalf of a student or teacher itself can call on this number if they face any crisis of a mental health. And even primary healthcare providers like MBBS and Ayush healthcare providers, nurses, anybody can call if they met any cases related to mental health related, and they can't even identify what kind of a mental health disorder. Is it a mental health disorder? To confirm also, they can call on this number and get help of it. Until now in Telemanas, we have received a different type of a calls, and most oftenly we have received a calls related to sadness, stress, sleep disturbances, anxiety, and exam related, and including a substance related calls we have received till date. And these are our manuals which are available on Telemanas website, Ministry of Health and Welfare. So if anybody want to use it for their students or the colleges and any universities, please download it and use it. These are all the manuals for a day-to-day lives. It may help you like identifying the cases or assessing yourself and how we can treat other people, being a medical professional people. So it may help you in identifying the cases as well, and better for our life itself. So we can refer. These are all the manuals. And thank you one and all for giving me opportunity, and special thanks to Dr. Bala sir, Arki sir, Tamil, and thank you to Susila ma'am and Usha ma'am for having a huge number of participants from Andhra Pradesh. Thank you so much.
Thank you so much, Ms. Sampada, for that clear and a very comprehensive and a very truly inspiring overview of Telemanas today. You have beautifully taken us from the National Vision launch at 2022 right up to the 24/7 helpline 14416 that is today touching the millions of the lives of people, including the thousands in our own Andhra Pradesh also. Most importantly, you reminded us of something we must never forget. Behind every call, Telemanas is a real person seeking hope, and because of this service, they are no longer alone, they can feel it. And respected participants, and if you have any one ever feel overwhelmed and very anxious and depressed, or simply need someone to talk, remember these 4 digits 14416. That is a very helpline number. And once again, thank you, Sampada, for motivating us and knowing about the Telemanas. Thank you so much. And next, I invite, I am very pleased to invite D. Usha Pannagaveni, President TNAI, Andhra Pradesh Branch, Government Assistant Professor, Government College of Nursing, Srikakulam. And she took recently as a TNAI Andhra Pradesh Branch as a President. And I invite to give a presidential address. Madam, please. Over to you, Usha. So I think maybe some disturbance.
Ma'am, I think there is some ma'am got exit out of the Zoom, I feel, and we'll try to get back ma'am once again.
So meanwhile, if you have the, I request a participant, if you have any doubts regarding this TeleMANAS platform, you just ask. The experts are there to give you for questions or answers they will give. I request experts to answer our participant questions, please.
Chesara.
Ma'am, Usha, ma'am, please, ma'am, I think you are joined.
Yes, Usha, over to you. So you are not audible.
Ma'am.
Unmute Usha, please.
Hello.
Yes.
Yes, madam. Yes, madam.
Yes.
Some network issue
Please
and the power
ahead.
also.
Please
Yes,
go ahead. Please go ahead.
Thank you, madam. Esteemed dignitaries, dear Professor K. Susila ma'am, Registrar APNMC, Dr. C. Naveen Kumar, Professor and HOD, Community Psychiatry Unit, NIMHANS, Dr. Radhakrishnan Sir G, Additional Professor of Nursing, NIMHANS, and President of ISPN, Ms. Sampada Hanchinamani, Nursing Tutor, the National Apex Coordinating Center, TeleMANAS, NIMHANS, Dr. Balamurugan Sir, Assistant Professor of Nursing, the National Apex Coordinating Center, TeleMANAS, Mr. V. Tamil Pulvendran, Nursing Tutor, the National Apex Coordinating Center, TeleMANAS, significant others and distinguished delegates attending the webinar, the compliments of the season, and a bright morning to you all. At the outset, may I take the proud privilege to extend my heartiest welcome to panel of resource faculty, distinguished others, and the delegates attending the first online webinar on TeleMANAS 2025. There is a famous saying that the greatest wealth is mental health. Mental health is an important aspect of our well-being, which determines the person's ability to function psychologically, emotionally, and socially. Sound mental health is crucial for productive work output and promotes meaningful contributions to the society and the country. When psychological wellness is affected, it can cause inappropriate behaviors that may affect personal health, compromises one's ability to carry out their normal roles and responsibilities, and disrupts one's ability to handle life's curveballs. India significantly contributes to the global burden of mental disorders by 18%. The statistics are still increasing. Recent national level studies have highlighted that 15% of the adult population in India have mental health issues requiring intervention, and a wide treatment gap of 72 to 92% exists for a range of mental disorders. Thus, a large segment of the population requires assistance for mental health and well-being. However, people tend to neglect and ignore their mental well-being and consider it is a social stigma to approach mental health care. On behalf of TNAI branch, President Mrs. D. Usha Pannagaveni, we personally appreciate the Ministry of Health and Family Welfare, Government of India for launching the National Tele-MANAS Health Program, Tele-Mental Health Assistance and Networking across states, Tele-MANAS on 10/10/2022 at NIMHANS, Bangalore. We are proud to acknowledge that Telemanas is the digital arm of the district mental health program and aims to provide universal access to equitable, accessible, affordable, and quality mental health care through 24/7 tele-mental health counseling services across all India states and union territories with assured linkages. The Telemanas allows the public to access the helpline by dialing toll-free number 14416 or 1/800/891/4416 from any corner of the country. India is a home to 1600 languages, including 22 officially recognized languages listed in the Indian Constitution. It is commendable that this helpline offers support in more than 20 plus languages. We are glad to share that in Andhra Pradesh, we have two Telemanas cells, that is one at Government Hospital for Mental Care Visakhapatnam and the other one Siddhartha Medical College Vijayawada. Government Hospital for Mental Care Visakhapatnam has receiving 300 plus calls in the month from last few months, and most of them have undergone counseling and treatment under the video calls. Some are still under the treatment, while many of them have embraced a positive attitude towards life. Siddhartha Medical College, Vijayawada are also receiving innumerable calls. Their prompt response has caused valuable difference in many lives. On behalf of TNAI AP branch, we sincerely congratulate the organizers for their efforts towards facilitating this webinar to create awareness on Telemanas, in turn attempting to empower every individual's right to take care of their mental health by overcoming the societal stigma. It is polite request to every delegate attending this webinar to spread this awareness among the public, the community around you, your friends, the elderly population in your surroundings, the grocery store you visit. In fact, take a minute in your conversation with everyone you cross path with, so that people become aware of this initiative and the manifold benefits associated with this. One call to save one life. A phone call to Telemanas has turned out to be the golden hour in a resisting life of many who were almost ready to give up. Nursing faculty and nursing students kindly disseminate the information to the patients when you go for your clinical duties and community field area when you are posted in the field. Always with you in service, please do count on me for assistance for any kind in this concern. Let us spread this awareness to the grassroots levels of our community. It is my ardent request to each one of you to join hands with us to promote mental health or physical health. Before I wrap up my presidential note, on behalf of TNAI AP branch, we thank the organizers and Telemanas team for giving me an opportunity to address today. Wishing you today's webinar a grand success with a fruitful discussion. Thank you, one and all.
So you are very great, madam. So you just reminded every nurse watching today that we are not just a healthcare providers. We are a life leaders of the mental health for our communities. Madam, your words are not just inspiring and it's igniting. You have charged every single one of us to become a proud ambassadors of the Telemanas wherever they go. On behalf of the entire TNAI Andhra Pradesh family and all our viewers, a thousand thunderous round of applause and our deepest gratitude to our dynamic president, Mrs. D. Busha Pannagaveni, for this powerful and soul-stirring presidential address. Thank you so much, madam. Thank you.
Thank you, madam. Thank you, madam.
Next, we will move on to the question and answer session by the Dr. G. Balamurugan sir and Tamil Pulavendran sir. Experts are there on the platform. And I am requesting all the participants, if you have any doubts, you please ask, the experts will answer the questions, please.
If you have any questions, you can raise your hand. We will unmute from our side, or you can type in the chat box. So we will try to respond to your queries. So meanwhile, once again, I feel Dr. Usha ma'am is not from AP, she is from Telemanas. So we are very, very happy the background work, ma'am, how you did and the information what you have gathered and shared with the participants. It's really
Thank
a
you, sir.
very, very, very heart-touching to us. We need people like you, ma'am, and like ambassador for Telemanas so that it will take it to all the ground level. So people who are in need, they can get help. We're very, very happy to hear you, ma'am. And
Thank you, sir. Thank you, sir.
participants, yeah, you can ask questions, you can raise your hand, we will unmute from our end, or you can type in the chat box, so we will able to address one by one.
Any questions, please? The teachers and the students and the nurses. So those who are participating in this webinar, please, if you have any doubts.
Venkataramana.
Good afternoon, sir.
Good afternoon, ma'am. Good afternoon.
Good afternoon, Susila madam and Usha madam.
Good afternoon.
Yeah, good
Madam.
afternoon.
Is there any training is there for this giving counseling for Telemanas?
Ma'am, as we presented earlier, it is a national program, ma'am. So where the Telemanas counselors are recruited by state government. For example, in Andhra Pradesh, recently the recruitment has happened, where the Telemanas counselor recruited by the state government, and they are placed in Visakhapatnam cell as well as in the Vijayawada cell. So from our side, from NIMANS, what we do, we train them. So the training is very rigorous. So what we do, generally we start with the first, as soon as they joined in the Telemanas, there will be 3 days online rollout training program, followed by there will be an on-site training program. A team from NIMANS will go to the respective states. For example, in last year we went to Vijayawada, and we are come back again Vijayawada, Visakhapatnam for the newly joined counselors. We do 2.5 days training only to improve the skill on telephone counseling. Skill focused training will be there, followed by a 3-month learning management system training program. It is a skill-based online training program is available, and the student counselors will go through the training program. After completing all this training program, they will be accredited as a Telemanas counselors. So that's the way the entire training program is scheduled, ma'am. Since it's a government program, the counselors will be recruited by the state governments and trained by NIMANS, ma'am.
Yes, sir. In the
Yes, sir,
Telemanas
for your detailed-
centers, sir, every shift they are posting 3 counselors, sir. Morning shift 3 counselors, afternoon and night also they are posting. They are keeping 3 counselors in the Telemanas centers.
Yes.
So they are guiding, sir.
Yes, ma'am. As ma'am rightly mentioned, it is available 24/7, 365 days. So the counselors round the clock they are available. We can able to serve the callers who are call at any time, ma'am.
Thank you, sir.
Thank you, ma'am. Melvin David, ma'am.
Sir, good afternoon. Could you hear me, sir?
Yes, ma'am.
Good afternoon, sir, and good afternoon, Registrar Madam and President Madam and all of them. And my doubt is like now recently I come across some studies. People have started using these large language models and started trying conversation with the emotional things. Even I have inquired with a couple of my students, and they also like whenever they feel stressed, they're just chatting with these chatbots like ChatGPT or Meta or something like that. And this younger generation are experiencing a lot of stress. I don't know, maybe the coping mechanism are not good, I feel, as we observed. So is there any plan of integrating kind of, because some people are reluctant to talk to people and they may not have maybe they are receptive in talking to people and conveying their emotional thing, instead of just started chatting with the unknown chatbots. So is there any plans there? Because we also have a plan of implementing at least with the institutional level how students are talking to these chatbots kind of a thing. Is there any national level thing integrating with this program?
Thank you, Mr. Melvin, for asking this wonderful question. If you see that the health-seeking behavior over a period of Gen X, Y, Z, now Gen Z, Alpha, Beta, the health-seeking behavior is changing drastically. Now the Gen Z people are more digitally, we can say, they born with the phone and they're growing with phone. So they are very fond of seeking help from the technology, and we are very much aware of it. So we have TeleManas app. The TeleManas app is available both in Android as well as iOS platform. There we already have one menu-based chatbot is already available called Ask Me. So if possible, I'll try to show a small video about that. Our team is working on that.
Sure.
So that is a very basic module where the menu-driven chat is available, because
So somebody making a noise, please.
Yeah. So because the chatbots what is right now available, none of the chatbots are validated or approved by any government agencies. So that's why we are not encouraging that chatbot, but still a menu-driven chatbot is available, so that they can make few chats, but ultimately we encourage them to talk to TeleManas counselors. So this is the whole thing is happening right now, Mr. Melvin. But as you rightly mentioned, sure, there is a
Sir, because this younger generation are more dependent on these newer technologies. That is the concern, because we have to adopt that technology and utilize more ethically how possible.
Yes, you're right. So we're working on that. A small way we started with the Ask Me chatbot. So before going to Ms. Sadhana, there is a question in the chat box. Sir, because of COVID, the client feel alone. Now we find that they want to repeat the same process in explaining again and again. What type of action we have to take, sir? Krupa Bharati, ma'am, can you please unmute and tell me we're not getting that question?
Sir, good afternoon, sir. Good afternoon to all
please.
dignitaries.
Please tell me.
This type of incident is seen on my in-law only, sir. She affected with COVID. Then after she faced some of the disturbances during the COVID period. So we found out that after marriage, she came to our house. Individually, she used to talk herself, sir. So many times we ask what you are doing or like that. She explained during COVID time we feel some sort of difficulty like that. We taken some type of treatment of her. She is feeling some type of nervousness and feeling unable to express her feelings to others because of untrustworthy.
Yeah. So, ma'am, if you have any concerns related to that, please call TeleManas. If it is related to distress, definitely our counselors will address the distress calls. Concerns, if required, definitely she can talk to that in the same call only. She can talk to our psychiatrist who is available already in the team. And if required, the same call can be converted to a video consultation also, so that we can do a kind of video consultation. And we suggest better you can take help by taking first step calling TeleManas, ma'am, which will be more helpful.
Thank you, sir. Thank you.
Thank you. Miss Sadhana.
Good afternoon, respected Register Madam, Susila Madam, Usha Madam, and TeleManas team. I'm calling from Kim Samlapuram, ma'am. Sir, I want to have a question that what about the acute illnesses who can't able to communicate even through TeleManas? How can they approach the team? And how far they can get the treatment or some counseling for the people? How randomly any things are happening with this TeleManas?
Yes, ma'am. Thanks. Thank you, ma'am, for asking this question. For person with acute illness, definitely they need a treatment, ma'am. So our TeleManas team encourage them to get treatment. So that's the reason in Telemanas, not only callers, we can call on behalf of somebody. For example,
Yes, sir.
a teacher can call on behalf of student. An ASHA worker can call on behalf of family members. CHO can call on behalf of a patient. So that's the way the system is working, so that the next person can help the caller who is in acute illness. So we'll try to help you to find out the nearby place so that they can go and get treatment first. So that is the way Telemanas can be contributing to handle this kind of acute illnesses.
Any cognitive related programs were there in Telemanas, sir?
In Telemanas, we believe, ma'am, our counselors, because it's only on telephone based now, 80% of distress call can be managed by our counselors through audio mode. So that is our, we believe. Remaining any therapy is required, we have mental health professionals. So they can only handle therapies. Clinical psychologists available, psychiatric social worker available, psychiatric nurses available. And through video consultation, they can conduct these therapies. They can conduct online CBT therapy if a clinical psychologist is available in the cell. It can be possible.
So in future, you want to expand your terminal, sir? For example, in Andhra Pradesh, we are having only Visakhapatnam and Vijayawada, 2 terminals. What about the rural population?
Ma'am, that's the reason the technology is useful now, ma'am, because there is no boundary in technology, ma'am. Anybody in any part of Andhra Pradesh call, it will reach you any one of these cells.
Okay. So reaching is easy, sir, but what about the treatment, next step?
Yeah, treatment, as we are closely working with the government of Andhra Pradesh, and I think we have 25 DMHP functioning units are there, ma'am.
District level.
Yes, district mental hospitals program is available in Andhra Pradesh. So Telemanas team is closely working with the DMHP team. So wherever the nearby place, we'll try to connect them for the treatment.
Okay, sir. Thank you. Thank you for the good information.
Thank you, ma'am.
Good afternoon, sir. Good afternoon, sir.
Yes, ma'am. Please.
Sir, I am Padmavati, sir, from Government College of Nursing, Srikakulam. Good afternoon, respected Telemanas team and gorgeous and dynamic registrar Susila madam and TNAI President Usha madam. A very good afternoon, one and all. Sir, I have a question. How can we integrate Telemanas awareness activities into NSS special camps? And we can Telemanas team members visit colleges for awareness sessions?
First point is, if you like to convey our thanks to you, ma'am, because we have a thought of creating awareness through NSS. And ma'am, you tell us what you want, we will share, ma'am. And main request from our side is try to spread this awareness as much as possible. And what we will do, right now we have the already developed some 40 plus awareness materials available. We will share it with Usha ma'am. It is in 3 languages right now, English, Hindi, Kannada. So we'll share English and Hindi so that you can use the similar material to for the publication or IEC purpose. And if you need anything else, please let us know, ma'am. From our side, whatever things best possible, we'll do it. So one simple request from our side is, wherever you go as an NS activity, as Usha ma'am rightly mentioned, when you go to community, please share this number with the people so that they can get help whenever they are in need, ma'am.
Yes, sir. Yes. Thank you, sir.
Yes, ma'am. Before going to the next question, there are 2 chat questions, sir. There one is Kadri asked, good afternoon, sir, ma'am. Why government didn't fill the regular new jobs in nursing profession, please? And I feel this is a very good question to a wrong person. And so we'll go to the next question. Good afternoon. Suppose the person is not treatable online and resistant to go to hospital. What do we do? Dr. Priyanka asked about this question. Here, as per the Mental Health Care Act 2017, if there is a harm to individual or others because of the illness, mental illness, that person can be brought to the hospital for the treatment purpose. So that is, as per the Mental Health Care Act, we can do the service. So if you find anybody, for example, we can tell you here, in Karnataka, we're trying to work with the police department. Suppose any person is wandering mentally ill in the street, somebody called to this Telemanas number. So we take help from the police department. So police department will go there and bring the patient and admit to the nearby psychiatric hospital. So like this, we can able to help the individual. So similar tasks are going on in state-wise, ma'am. State by state is working, ma'am.
Hello, can you hear me?
Yes, ma'am. Dhanusu, ma'am, please.
Yeah, I am Dhanusu from AIMS College of Nursing Principal. First of all, really I thank and appreciate the effort was taken by Susila Madam Registrar and Dr. Usha Madam. And also, a special hi to Dr. Balamurugan and Mr. Tamil Pillavendan and Mr. Sampanta for being available here in the screen. You are looking very, like very approachable. You are looking and you are giving answers for the questions. So from my side, one question is how far the confidentiality is maintained while they are reaching you?
Thank you, ma'am. Thank you for asking this very, very important question, ma'am. So we always believe in confidential because since the national program, we adhere to the Mental Health Act 2017, DPTP Act and IT Act. So we say it is 100% confidential. So what is the meaning of 100% confidential is none of the phone calls are recorded. If any callers call to TeleManas, their calls are not recorded. Second, their phone number is not visible to the counselors. If you call from my phone, the 10-digit number will not be shown to the counselor. Instead of 10-digit number, it will be coded into a 16, 17-digit number. That number only will be visible to counselor. Counselor will not know the number of the caller. Third, the caller need not to tell their name, where are they calling, and their age. If they are giving consent, they can tell. Otherwise, it is not at all required. So none of the calls are recorded. We no need of any of your personal identity. So what is required in TeleManas is only if you are in distress, share your distress. So that our counselors are trying to address the distress. So that's the way the confidentiality is maintained in our TeleManas map.
Okay. So as Madam has told that we also have a service in AIMS.
Yes.
So like TeleManas was started and some of the contact points they have created. So thank you for that. And I hope you can visit AIMS College of Nursing also once for this awareness program.
Sure, ma'am. AIMS Mangalagiri is our mentoring institute, ma'am. So the Dr. Vijay Chandra Reddy sir is the faculty in charge. Under his, we have a 5-member team is working. And they are mentoring Vijayawada and Vishakhapatnam cell in collaboration with our team, ma'am.
Okay. Thanks.
Thank you, ma'am.
Thank you, ma'am.
Add on this thing, sir. Actually, ma'am, add on this thing. So we launched a app also, ma'am. In that app also, special thing is whether you are downloading any apps from the Play Store, you have to mention your names or something, your location details you have to mention. But this app, you no need to mention anything. So directly you are selecting download from the app, you can directly download it. There is no any information we need. That's all. Now sir is telling that Ask Me also we introduced. That like a chatbot that automatically it will give some voice based or some whatever we need. Based on our instruction, it will direct you to main things. So it is basically like that only. So this way also we are maintaining the anonymity.
Over the TSR BSc College of Nursing.
Thank you.
Thank you, ma'am.
Yeah, there is 2 more questions. One is how MANAS plays a major role in college curriculum or activities, sir? Actually, since the inception, I think in the year 2023, UGC has given a circular to all the universities to display the TeleManas number in all the college under the universities, including the hostels and mess and other common rooms wherever possible, so that TeleManas can be implemented, TeleManas service can be utilized by as many as possible. So now I request, I think we have many teachers, faculties are available here. So please place this TeleManas posters that we will share it with Usha ma'am. You can place it the common places so that the students in need, they can get help from this service. Yeah, I think one more question here.
How to ethical?
Yeah, how to maintain ethical aspects. So ethical aspects, as I told you earlier, we adhere to the national laws, Mental Health Act 2017 and DPTP Act we are adhering. So based on that, we'll take decision on calls, and we have standard operating procedures for different scenarios like self-harm calls, prank calls, and emergency calls. We have standard operating procedures. Our counselors will follow the standard operating procedures. And Sri Manasa, she asked, how can family members and caregivers be involved in the treatment process when the person is mentally disturbed, and how the team acts in the particular roles? As I told you earlier, a family member can call on behalf of the patients, and the remaining process same. So they can consult, get counseling from the counselors, they can get a consultant from the psychiatrist, they can go to a nearby place where they can get the treatment. And
how can we handle the kids who continuously depending on mobile set?
Yeah, so the next question is how to handle kids, those who are continuously depending on mobile. Again, I'm repeating here, Telemanas is mainly meant for the distress part. The individual in distress, definitely our counselors can address the distress. If it is going to be more concern, and we advise them, we suggest them to go to seek treatment in person. And second, here the children, and they are in higher usage of devices, better to seek help from the nearby places. So that, but Telemanas will help you to find out nearby place from where the caller is calling.
So one more question she asked her. So how we are doing follow and also review who already got help from Telemanas?
Yeah. So can you answer? Yeah.
So actually, ma'am, in this part we have the counselor or MHP. They made like a follow with that's also it is based on the with concerns of person caller. So based on that, after 3 days or after 1 week, they may like follow the follow up they will do. For example, in the review, in the sense whether we have some interventions, there are 3 to 5 interventions we have based on the person or caller need. We are teaching them, and also the counselor they mention like.
Sir, voice not audible, sir.
Yeah. So next question is, what is the basic waiting time someone respond to attend the call? Actually, here our waiting time 3 to very less only below 3 minutes, I think. 3 to 5. So it is based on the waiting time. Generally, we are expecting is whether they're selecting a language and then they will reach the counselors. For example, if the selecting language based on the language basis, the call reach to the availability of the counselors, then it will take a minimum 3 seconds to 4 seconds. We will reach the counselor. In case already the counselor is engaged, some other calls means your call shows like missed call. After the completing that call, counselor automatically they will make the again what are all the there in the missed calls, they will call again.
So we have one more question: how to reach public other than health professionals and hospitals? So that is a big challenge you are facing right now, ma'am. So that's the reason now I can proudly say we have 1,000 ambassadors are available right now with us from Andhra Pradesh. All of your ambassadors, please take this message and talk to your family members and your neighbors about Telemanas. So that's the way we can spread the message. And other than that, even every government, they are doing some kind of activities. For example, in Pondicherry, they made one small clip during the interval in movies, in theaters. They made one small video clip on advertisement clip on Telemanas, and some social media things are happening. So like this, each state is working on that. From national level, we do advertisement in Doordarshan, All India Radio, and we have our national level social media plugin handles are available. So there we try to promote Telemanas. So that's the way we are trying, and we need all of your help and hands to improve the awareness about Telemanas, especially in Andhra Pradesh.
The client is not a family member, like a street person who don't know about their family. For those persons, how can we help?
Yeah, this as already told you, we can get help from the police. So if you call Telemanas, from Telemanas, we'll try to connect with the police, and police will help us to find out, first point, they will try to find out the nearby place where they can get treatment. Then the remaining, they will take it up as a wandering mentally ill patient's care. And
excuse me.
so what about drug addiction patients? And here ACSR Government General Hospital Nellore need counseling center and give opportunity to BSc nursing students as counselors. Ma'am, as Prasanna Kumari ma'am, she told, again I'm trying to tell you ma'am, this is a government program. The counselors are recruited by the state governments. So that is the way the entire system is working. And Manjula Devi ma'am asked about timely referral. One of the objective is facilitate timely referral, but not for rural people. Mental hospitals are accessible and how to provide this service. I think Manjula ma'am asked a very important question. Service available only in the hospital. So TeleMANAS is one of the technology which help us to bridge the gap. But however, NIMANS, we have another mandate, and all the governments have another mandate of training the primary care service providers. For example, if you see the CHOs, community health officers in the health and wellness center or Ayushman Arogya Mandir, right now their package is extended from 7 to 12 package. The 12th package is mental health care. So CHOs working in the health and wellness center are supposed to deliver a mental health care because he is a BSc nurse or he is a BSc nurse. And from NIMANS, we are training all the CHOs also based on the request from the state. We conduct the online training program and on-site training program. I think Sampada can share how we train Chhattisgarh. You can just 2 minutes. You can share how we train Chhattisgarh CHOs.
So for Chhattisgarh CHOs, we have
Good morning.
Online and on-site, both the kind of training. So it's a hybrid we can call. So first we will train them in online. So it will be having 12 sessions, including all depression and normal common mental disorder and severe mental disorder. So then we will go to particular district in a on-site where all the block level, taluka level, all CHOs will come and take the benefit of on-site training. So the same classes will be repeated in person and we'll ask their problem, how they can develop their skills in identifying the cases in a rural area. So it's a huge updated thing. Like Chhattisgarh is one of the module training for the entire India, where we are training the CHOs and they are doing a really good job in identifying the cases in a rural area around 3,000 to 5,000 population they are working on, and more than 1 lakh of cases we have found in with the help of a CHOs by training them. So this is how entirely we work for a CHOs training in Chhattisgarh.
And to add on to this, not only CHOs, we train the medical officers also. So once the CHO screen the mental health concern, she can refer to a medical officer. Medical officer can treat the minimum, we say common mental disorders can be treated at the medical officer level. Then it will go to the tertiary care hospital.
Yeah, excuse me, sir. We are running out of time.
Yes,
so
yes, ma'am. Yes. Yeah, I think we have answered all the questions, I feel.
Yeah, thank you.
Yes, ma'am.
So every answer you gave was not just a knowledgeable, sir, but filled with a very empathetic and a clarity and your real life situations you have shown to us. And you did not just respond to our questions, and you removed the majority of the doubts which participants are having. You built a confidence and you showed a every year today that the TeleMANAS is a truly service they can trust and use without any hesitation. Because of your valuable insights and hundreds of frontline workers and families watching right now feel more empowered than ever to pick up the phone and dial 14416 whenever help is needed. On behalf of TNAI Andhra Pradesh State Branch and every single participant, a big round of applause and our deepest gratitude to our wonderful experts for your time and your wisdom and your unwavering commitment to mental health program. Friends, let us all promise today we will take these learnings and this helpline number to every home, every panchayat, and even every remote areas also. Thank you once again, sir, for your question and answer session. And before that, concluding, so just I want as a moderator, I want to say something about how these TeleMANAS can propagate. Please do these 5 small actions. They will take less than 5 minutes to total, but will touch the thousands of lives, I feel. So number 1 is save the number yourself right now. Open your phone and save 14416 as a TeleMANAS mental health helpline. Do it and speak. It takes 10 seconds only. The second one is a forward this webinar link or recording to at least 10 people in your WhatsApp group. Your staff nurses, maybe the group, A&M group may be there, ASHA workers group may be there. So please share this recording or YouTube link to in the WhatsApp groups. And the third one is add 14416 in your phone status WhatsApp story for the next 7 days with a 1-line message. Feeling low, someone to talk, call 14416 and free. It's a cost very free of cost, 24/7 TeleMANAS. Please put a status for 1 week and maybe I request a profile also. Tell at least 5 patients or family face to face in the next week. Just 1 sentence. So there is a free of cost TeleMANAS is available at your doorstep. And the 5th step one is put up one small poster or write on the put in a college and like hostel premises and hospitals, wherever it is available. So you please initiate and put a sticker so that everyone should see and they can able to identify the TeleMANAS is available for them, because when they are feeling low or when they are feeling depressed, when they are feeling frustrated, right? So I think some of the few things we can make it and we can make the change in the people regarding the mental health. And also, so I request the President, Madam, please initiate this type of program to I think this group is mainly the students and the teachers of the institutions, but we can propagate it to other communities of our nursing, like, CHOs, ASHA workers. I think the community chairpersons and the nursing service chairpersons of the TNAI, AP and A&M category also take initiation to propagate this. And so we will have another, with the permission of TeleMANAS, Sampada Madam, please. So we will have another programs like for our CHOs and as well as our ASHA workers, so that they can be, our vision is to reach the grassroots levels. So that will be, I think. So thank you so much, Madam, for the TNAI AP branch and as well as the TeleMANAS team for motivating us and inspiring us through your deliberations, and as well as your question and answer session was very wonderful. And I hope we'll meet you soon. Thank you so much. And
thank you, ma'am.
We'll have vote of thanks by Mrs. K.V. Sridevi, Secretary, TNAI AP branch.
Madam, please unmute Sridevi, madam.
Yes, madam. Already unmuted, madam.
Okay.
Good afternoon. Good afternoon, one and all. I am K.V. Sridevi, Secretary, TNAI AP branch. On behalf of the TeleMANAS webinar organizing team from Enhance and TNAI AP branch, I am deeply honored to present vote of thanks on this special occasion. This session was highly informative, well organized and beneficial to all participants. We deeply appreciate the dedication, expertise and commitment shown by the entire Enhance team. First and foremost, I extend my heartfelt gratitude to our today's moderator, our Susila Madam, Honorable Registrar APNMC, for taking the time to share such valuable insights, Madam. Your words have truly motivating and illuminated the vision of TeleMANAS. I extend my deepest gratitude to our presider, Mrs. Usha Pannagaveni Madam, Honorable President, TNAI AP branch. Madam, we are deeply honored by your gracious presence and encouragement to advancing mental health services. Then, I extend our deepest gratitude to Dr. Radhakrishnan Sir, keynote speaker. Sir, your systematic and thoughtful insights added a great depth to our knowledge and appreciation of TeleMANAS. Then, I am delighted to extend a heartfelt thanks to our presenter, Ms. Sampada Madam, for her excellent presentation, Madam. Your team explanations, valuable insights made the session highly informative, madam. Thank you so much, madam. I would like to express our sincere gratitude to Dr. Balamurugan sir for conducting an excellent question and answer session. Your clear explanations and willingness to add every query, to address every query and greatly enhanced our understanding, sir. I would like to extend our sincere gratitude to Mr. V. Tamil Polavendran sir for conducting an excellent question and answer session. His clear responses, thoughtful explanations helped to provide clarity on many important points, sir. We also thank all distinguished participants, principals, faculty members, nursing officers, CHOs, ASHAs, ANMs, health workers, and my dear students for your active participation and support. Finally, a big thanks to everyone who worked to coordinate, share, and promote this session. Thank you once again for making this Telemanas webinar a grand success with the 1,000 participants, more than 1,000. Thank you so much.
Thank you once again, madam.
All the team. So have a great day. Have a great day, all of you.
Yes.
Thank you, madam.
Thank you, madam.
We'll meet you
Thank
soon.
you. Thank you, Nimhan's team. Thank you so much, sir.
Thank you, madam.
Thank you.
Thank you, madam.